Dr. Marissa Gomez-Martinez. I'm a family medicine physician, medical director for DHR Health, Edinburg CISD School-Based Health Center. Okay, so for example, patients with lung disease, we already know that COVID-19 infects the lungs. So if somebody already has a pre-existing condition that affects the lungs, it's just going to add more more inflammation, and it can worsen the condition. Vaping is one that we don't think about very often, and that's our younger generation that has started to vape. And a lot of people think that vaping isn't bad for you, it's not like smoking, when in reality it may be even more harmful than smoking. We're still learning so much about it, and that's one thing that's so preventable and can cause a lot of fibrosis, inflammation, and even long-term complications that may be irreversible. So that's one of the biggest things that I wanted to give as a take-home point for especially our younger generation. Stop the vaping, don't start it. Tell your friends to stop. There's just not one good thing that comes from vaping, and we've seen a lot of complications from it. For example, we're in allergy season and asthma season. So we're seeing a lot of other respiratory infections, not just COVID, and those younger populations, like the teens to the early 30s, who normally would have a cold and it wouldn't be a big deal, are having more, they're really struggling with getting through just a simple cold. It's lasting for weeks to even months. We've seen more complications of pneumonias. So, and not just with vaping, but certainly the risk increases if people are vaping.